Good afternoon, everyone. Thank you for coming to this session. And thank you, Dr. Agers, Collins, and Dr. Murray for putting together this panel. I'm very pleased to be here today, and I'm looking forward to having an interactive discussion. My presentation is about reducing disparities through strategies that aim to prevent obesity, such as food policies and food environment near schools. Let me see if this works. And I have no conflicts of interest or relationships to disclose. I'd like to take a moment to acknowledge the research team that I work with. Some of them are here today in the audience. I'm very lucky to work with them to produce this research. And I also wanted to thank the Robert Wood Johnson Foundation and NHLBI for their funding support for our research. First, I would like to share three main take-home messages of this presentation. The first is that if we can successfully reduce obesity disparities, especially in childhood, we could make significant progress in reducing health disparities more broadly. Secondly, given that we have had little success in reducing health disparities, it is critically important that we identify existing policy interventions and determine their effects on disparities. Those policies could reduce disparities even if they were not designed to do so, but they could also increase disparities and, of course, have no effect as well. And finally, in order to thoroughly study the impact of policies on obesity disparities, it is necessary that we incorporate environmental factors in our analysis. So throughout this presentation, I'm going to refer to disparities as differences primarily along the lines of race, ethnicity, but also socioeconomic factors and urban, rural, suburban classifications. As we all know, preventing obesity is a major public health goal in the US, and that is because obesity is associated with increased morbidity, higher mortality, and healthcare costs. Reducing obesity in childhood is particularly important as 1 in 3 children between 2 and 19 years of age are classified as either overweight or obese. And although obesity seems to be leveling off among younger children, the leveling off is not occurring equally among all population groups. In addition, the prevalence of obesity remains very high. The other issue of concern that I wanted to mention is that obesity in childhood is associated with obesity in adulthood. At the national level, there are significant racial and ethnic disparities in childhood obesity, with African American and Latino children having the higher prevalence than their white peers. Also at the national level, obesity disparities between Latino and white children tend to be larger among those who are in middle or high school age. As you can see from this graph, children are the most diverse sector of the US population. By next year, in fact, it is estimated that among the child population under 18 years of age, slightly more than 50% will be coming from minority backgrounds. And these projections suggest that the trend will continue to increase over time. So if children of color continue to have higher obesity prevalence, we might expect to have an increasingly larger, sicker population as children become older. By contrast, if we can effectively prevent obesity and reduce disparities, we could expect to have a larger, healthier population as children become adults. And this has broad implications for the nation as a whole in terms of a host of other factors, including positive influences on productivity and a strong economy and lower healthcare costs. So it is, so I think it should be an imperative that we successfully prevent obesity and eliminate or reduce racial disparities in childhood obesity among these populations. I'm going to switch gears a little bit and now talk about the research in childhood obesities and the obesity disparities. So the majority of this research has primarily focused on either describing the disparities or explaining them. And some studies have found that socioeconomic factors partly explain these disparities, but not all studies agree with this conclusion. There are a number of policies that could favorably influence disparities, even if the policies were not designed to do so directly. And the field of obesity prevention is a good candidate to find these interventions. And this is important for several reasons. First, there's been a few large-scale policies that have been enacted at the state and federal levels. And those policies seek to transform school food environments rather than focusing on changing behaviors at the individual level, which has not been as effective in preventing obesity, particularly among disadvantaged populations. And finally, these policies affect large numbers of children, so they could have a large population level impact. Sorry, this is not working well. Okay, so one example is California. In 2001, California enacted a nutrition policy for schools that took effect in 2004, and I'm going to call this the California Junk Food and Drink Policy, just for simplicity. This policy regulated foods and beverages that compete with the school meals program, and the main focus was to reduce the amount of sugar and fat and to restrict where and when those items could be available for sale to students in schools. Since 2004, many states across the U.S. have enacted similar policies, but the U.S. Congress in 2010 authorized the U.S. Department of Agriculture to regulate these competitive foods and beverages nationwide. And the implementation of this federal policy started in 2014. So in many ways, the states and the US government, the federal government, caught up with what California was doing early in the year 2000. In addition, in 2010, the Congress passed the Healthy Hunger-Free Kids Act, which improved the standards for school meals, effective in the year 2012-2013. And among other things, those standards reduce the levels of sodium, saturated and trans fats, limited milk to fat-free or low-fat, and increase the daily availability of fruits and vegetables in school meals. So together, these two policies, I would argue, really transform a lot of the food that is available for children in schools. But very little research has been done to examine the impact of these policies, specifically on childhood obesity disparities. We were very fortunate to been recently funded by NHLBI to do just this. And in addition, we are going to be looking at whether the community food environment near schools modifies those policy effects. One of the research challenges, and I forgot to mention this at the beginning of my introduction, that I will be weaving some of these challenges that we're encountering in the research. I didn't want to include that as part of a slide separate from what actually is happening as we see the finding and so on. So one of the challenges is that exposure to the policies is not randomly assigned, and so there is no clearly identified control group. To address this issue, we will use the interrupted time series design, which is an analytic method that allows us to study the population-level influences of the policies when there is no control group. In addition, another challenge is that since we are interested in racial and ethnic obesity disparities, we need to have enough numbers to make meaningful comparisons. And we also need to have outcome data in the time before the policies took place and after the policies took effect to be able to determine if there is a significant, quote-unquote, interruption in the obesity patterns at the time in which these policies took place. So as you can see in our model here, this is a time when there was nothing in terms of policies going on in California. And then after 2004, the California policy took effect. So in our analysis, we're looking at whether there's a significant interruption in the obesity trends in the period after the policy took effect compared with the period before it. But in order to do that, we do need a time series, right, data. And then because there were about 10 years in time that the federal government implemented these other two policies, the school meals and the competitive food policy, we are able to then examine the effect of both policies together compared with when we only had one policy alone. In addition to the need to have outcome data for all these years, we also need to have data from other levels of influence, such as the school environment and the community food environments near schools. California offers a unique opportunity for this study because it is the most populous state in the nation and one of the most diverse. California has also a large geography with a mix of urban and rural communities, and this allows us to study the urban and rural differences in the policy effects. And most importantly, in California, for many years, we have been collecting child-level data through the physical fitness gram test series. So for our study, we combine data from 5 sources. That includes child-level data from the fitness gram, which has BMI, indicators. It has race, ethnicity of the children, as well as physical fitness. It's not a very rich data set in terms of very detailed variables, but it gives us enough to be able to examine these patterns. Then we link this data with school characteristics, as well as data on the socioeconomic environment of the school neighborhoods, and whether the schools are located in urban, rural, or suburban areas. We also link this data to the food environment, which came from the National Establishment Time Series, which is commercially available. In a previous study, we found that the California policies for junk food and drinks were associated with slowing the childhood obesity epidemic among 5th grade boys and 7th grade students in the state. However, we know that the environmental factors, there are a number of environmental factors that play a role in obesity, and they may undermine or enhance the influences of the policies on obesity and related disparities. For example, we have found that a differential effect of the policies on obesity based on school neighborhood socioeconomic factors, as can be seen in this graph. After the obesity was increasing in the period before the policies took effect, and it was increasing for all children, right? This is girls and this is boys. but after the policies took effect, obesity declined significantly among children who attended schools in the most affluent neighborhoods, while obesity plateaued in low and middle income neighborhoods. In a more recent study, we have also found that policies have a differential effect on obesity according to the level of urbanicity where schools are located. As you can see in this graph, among 7th grade males, the California junk food and drink policy is associated with steeper declines in obesity among those children who attend the schools in suburban areas, which tend to also be more affluent, followed by those in second cities and rural areas, although the decline in rural areas were not significant. I have a slide for that. Thank you for asking. Yeah. Can I come back to this? Okay. Okay. In urban areas, obesity was, this is the middle here, is slightly increasing, but the increases are not significantly different from zero. So children in these areas, we could argue that they experience the smallest benefit of the policy. And there are many ways that we can think about these results. On one hand, it is great news that the policies were associated with declines in obesity, even if some children appear to benefit more than others. At the same time, one could argue that from a population level perspective, the influence of the California policy was not as great because 60% of the children in 5th and 7th grades attend schools in urban and suburban areas, which were the ones that benefited the least. Another challenge of this research is that there may be other possible reasons for the differential associations with obesity, and this includes differences in the ways in which the policies were implemented by the schools in these areas. It is very, very difficult to come up with this data. There are some data that are qualitative and sort of more case study approaches. Also, urbanicity differences may be related to differences in the food environment near schools. And community food environments near schools are important because unhealthy food outlets tend to be concentrated near schools, and proximity to these food outlets is related to consumption of those items and increased body weight. Another challenge that we've encountered in this research is that the need to fully understand the distribution and changes in the food environment near schools. For example, we have found that relative to schools attended by majority white students, fast food outlets are more concentrated or more present near schools attended by majority minority students. In another more recent analysis, we found that the fast food environment near schools differs by school neighborhood income, by urbanicity, and time. And as you can see from this graph, the urban areas have larger concentration of fast food outlets, even among schools that are located in the most affluent areas, as compared with schools that are located in non-urban areas down here. We also noted here that fast food availability increased between 2000 and 2010 among schools that were attended by majority Latino students and that were located in low-income neighborhoods, as you can see here in the middle panel. So in future studies, we plan to continue this research to examine the influence of the policies, specifically on racial, ethnic, obesity disparities, using the ITS approach that I mentioned earlier, as well as longitudinal analysis. And we will also examine the role of the food environment near schools to determine if it modifies the policy influences. I just wanted to share some findings that we just got last week. So I wanted to just share them. They're still preliminary, but I wanted to show. This graph shows the obesity trends in the time after the California policy took effect. And the line, the dividing line, is the time when the federal policy for school meals happened. And as you can see, this is comparing Pacific Islander, Filipino, Native American, and white children. As you can see, during the time when the California policy took effect, obesity was either plateauing, slightly decreasing, or slightly increasing, but in either case, the news is good, right? That everybody is kind of benefiting. The rate of increase that we saw in the time that is not showing here, that was increasing for all groups, is diminishing significantly. And then after the federal policy took place, the line should have been actually here. It moved for some reason. It should be here in 2013. Obesity is declining for all groups. One thing to note is that obesity disparities between the three groups are pretty sustaining. They don't seem to be changing that much, right? So all of the other three groups have higher rates of obesity than their white peers. And we think, I mean, of course, these findings assume that all children are exposed to the same environments, which they are not. And so our next step is to look at more detailed analysis and to incorporate the food environment near schools. We expect that obesity disparities will be reduced in areas where children have exposure to the same environments. So I will conclude my presentation by restating a few points, and that is that to eliminate and reduce health disparities, it is really critical that we reduce obesity disparities, especially in childhood. Because we have a time problem, it is urgent that we identify existing policy interventions and evaluate their effects on disparities. But in order to examine the full effects of the policies on disparities, it is required that we examine the role of the environmental factors, because we know that exposure to these factors is differentially distributed across social groups. We also need to generate rigorous evidence by addressing methodological challenges along the way. And so all of these things together will help us inform the current and future strategies to prevent obesity and eliminate racial and ethnic health disparities, which are two major public health goals for all of us. Thank you. Okay, so the question is, I was asked to repeat the question. The question is, how do we define second city? And there are many definitions of urbanicities. The census has their own definition, and other people have their definitions. And we use the Nielsen data definitions because we felt that they incorporate more dimensions. The second cities, include, they're defined as moderately densely populated areas, like the suburbs, but they differ in that they have a primary population center of the surrounding area. So they're not so far off. There's still something going on. There's enough people to have this primary population concentrated around it. So I hope that answers your question.
Would that be within an area that has a larger city? Is that why the second city designation?
Yes, yes. And the definition includes density in terms of the population and employment centers and so on.
Okay, so the question that I have is that the federal school nutrition policy for school meals did not have a great impact on reducing obesity in urban populations. I think that your slides show that compared to some of the other areas.
Yes,
And what can be done about that?
yes, thank you for asking that. I think I probably misspoke. What we evaluated in the slide is the impact of the California drink policy. We haven't been able to evaluate the effect of the federal policy yet, but we did see that the children in urban areas did not benefit as much from the policy. And we actually kind of hypothesized that because this policy is regulating the foods and beverages that children can buy. And so we would expect the children who are more affluent, that have more money in their pockets, are going to be more impacted because those things are not going to be available for them to purchase. Whereas urban children who tend to have lower socioeconomic resources would not be as impacted. And so, but we do expect that the school meals policy will have a greater effect for them.
So do you know whether or not there is a standardization across schools in terms of the meals that they serve, regardless of context? Does it make sense what I'm asking? So do suburban schools and urban schools and rural schools, when they are serving the school lunches, is there a standardization in terms of what they have to serve, in terms of no French fries and potato chips, in other words?
Yeah, that's a very good question, and the standardization occurs only at the regulatory levels. So the schools are told how much fat, how much sugar the food should contain, but everything changes after the schools contract somebody else to do that. So I think that continues to be an issue, and it is a very difficult issue to measure, I think, because school districts have different ways of getting the food to the schools. So we may lose some of the standards potentially, and that's just a theory that I have.
Your slide mentioned a number of different ethnic groups, but not African Americans. I was wondering about the prevalence of obesity among African American kids.
Yes, thank you. So the prevalence of obesity among African American kids in the state, yes, I only provided at the national level, but they're higher also than white children. So the children with the highest rates tend to be African American and Latino children, but also some of the Asian subgroups that I showed in this slide who have not been studied extensively in the past.
What's the role of social class in examining those patterns across race and ethnic groups?
Well, this is this is a challenge, right? Because we know that social class is significantly related to overweight and obesity, and we tend to see that higher SES kids are less likely to be overweight and obese, but that relationship doesn't necessarily apply to among all racial ethnic groups. So for example, for African Americans, it's not always the case. You see more of especially among boys, you see more of a sort of a flat line than for, exactly. And so that's one issue. And the other issue is that neighborhood SES also plays a role. So even if you have a higher income, but you live in a neighborhood that is poor and that has greater access to unhealthy foods, that may still have an influence.